I am very big on research. I also, if there is a valid medical reason, I want to see that that happens. So I'm going to ask you some written questions later because I got other things I want to get to about, do we need a new schedule level that creates some kind of a hybrid, and any language that you might recommend to make the bills that you're concerned about allow us to use the relative medicines or drugs when we have a child that's had a lot of surgery and needs it. So I'll come back to that later. We won't get into that today. I'm now going to switch to Dr. Gingrich. Dr. Gingrich, many people may not know this, I'm sure you do, but my district is the only congressional district in the United States with 2 veterinary schools. One located at Virginia Tech, it's the Virginia Tech Maryland School in Blacksburg, School of Veterinary Medicine in Blacksburg, Virginia. And the other one, while licensed in Tennessee to the Lincoln Memorial University, is actually located in Lee County, just over the line in the 9th Congressional District. What would happen in the veterinary schools if the DEA administratively scheduled xylazine?
Thank you for that question. It's probably not surprising that in veterinary schools, few of those students, less than 10% nationally, are from rural communities, probably never having touched a cow before in their life. And so certainly, if xylazine is scheduled without the statutory changes to the Controlled Substances Act that is in the Combating Illicit Xylazine Act, we run the very real risk of no longer having access to that medication, which would increase the risk to those students in veterinary schools being around cows that are nervous or scared, especially if they're not used to working with them.
And we have a shortage of large animal vets in the country anyway, and that would increase the shortage probably as well of large animal vets?
Well, certainly, if you're injured by a cow as a student, it probably does not make you want to go into cattle practice, yes.
Yeah. As I said, my district's also the largest cattle-producing congressional district east of the Mississippi. In your testimony, you mentioned that there is no safe or practical alternative to xylazine for sedation in cattle. Can you elaborate on how restricted access could impact cattle farmers?
Yeah, thank you. So certainly anything that impacts cattle veterinarians will definitely impact cattle farmers too. Many may not have adequate facilities. We especially see that on smaller operations, such as is in the eastern part of the United States, such as your district. And certainly having a sedative available to appropriately restrain those animals when they need it examined or a medical or surgical procedure is very important.
I appreciate that. Mr. Olton. I know, I'm a little odd. I've toured landfills and sewage treatment plants and have been interested in how we can use that kind of infrastructure to better detect viruses, phages, and community diseases. This committee worked to get additional language in the Support Act that was signed into law to allow for more wastewater surveillance, and CDC is also looking into it. Can you talk more about why wastewater is so beneficial when it comes to detecting community drug use and what we can do with that data?
Thank you for your question. I'd start by saying that it provides a powerful early warning system. Just recently in the news, you see that there was Missouri had been working with various high schools that were voluntary testing. And what they had found over about a month and a half ago, a tremendous amount of nitazines were being found in the wastewater stream. So when we met with the leaders of the community and the folks that were involved in that, one of the first points they made is, we're not seeing a problem here. We don't see nitazines. This really highlights some of the issues. Medical examiners, toxicology, laboratories do not necessarily test for it. They do targeted testing. So if they don't test for it, they're not going to see it. So that's a good example of how it provides like a very, very quick, within hours to days response. Also communicable diseases, it's one sample that they need to test, and they can do a full gamut of tests on that. I do think primarily we need sustained federal investment in this type of technology. It provides not only the early warning, but it also provides a critical tool towards public health. Look what happened during the pandemic, that they were much further ahead than the hospitals were seeing that.
My time is almost up. I will say that I've been advocating that we get all of our groups collecting wastewater in particular to maybe get extra samples, because if the CDC is collecting it for one thing, if we're looking at it, from a disease standpoint, if we're looking at it from a drug standpoint, if we're looking for treatments with phages. We got different people collecting water, and it's coming, can't get to all those groups can't get to all the wastewater treatment, so what we're trying to do is get them all to work together and get extra samples so everybody can share.